Today we will be discussing asthma in children. I am Dr. Bibiano Reyes Jr., a pediatric pulmonologist in our institution. For this lecture, we will accurately diagnose asthma in children given a clinical case scenario and properly manage a child with asthma given a clinical case scenario. We define asthma as an heterogeneous disease usually characterized by chronic airway inflammation. It is defined by the history of respiratory symptoms such as wheeze, shortness of breath, chest tightness, and cough that vary over time and in intensity together with variable expiratory limitation. This diagram will show you on the left side a trachea that is inflamed, swollen, and irritable, usually seen among chronically inflamed airway. When there is acute exacerbation based on triggers, there would be bronchospasm and mucus plugging, causing difficulty of breathing, and what you see as asthma signs and symptoms. To diagnose bronchial asthma in children, the gold standard still is spirometry. Other parameters you can do PEFR or peak expiratory flow rate. You can do variability test, positive bronchodilator reversibility test, and a positive exercise challenge test. Most common trigger of asthma in children is still viral upper respiratory tract infection. Other triggers would be due to exercise, exposure to dust, smoke, pollen, molds, strong odors, drugs. Food is not necessarily to prescribe hypoallergenic diet. This table will show you the different triggers for every age group. As you can see, viral infection is still the most common cause of trigger in asthma in children. We classify asthma in children based on control. This is a questionnaire and help us diagnose what type of control the child with asthma has. Answering these questions, we can identify if the child is well controlled, partly controlled, or uncontrolled. This table will show you the different inhaled corticosteroids and their doses given on a child as maintenance to prevent attacks or controllers for bronchial asthma. Available drugs in our country are the budesonide and fluticasone. Asthma medications are divided into two, the relievers and the controllers. For the relievers, an example are the short-acting beta-2 agonists like your salbutamol and your terbutaline. Another example is the anticholinergics like your ipratropium bromide. For the controllers, you give corticosteroids, either inhaled or systemic, leukotrienes modifier like your Montelukast, long-acting beta-2 agonists like your procaterol and salmeterol, and the older drug sustained-release theophylline. This is an example created by Global Initiative for Asthma, a stepwise approach for less than 5 years old children. So it is divided into different steps. Step 1, Step 2, Step 3, Step 4. Based on this table, the preferred controller of choice still is the inhaled corticosteroids. If you start to control your child with asthma, for example, in Step 2, you can start a low-dose inhaled corticosteroid. You have the option of giving other controllers like eucotrienes. For the reliever, you give the SABA or the short-acting beta-2. However, if the symptom pattern consistent with asthma and asthma symptoms are not well controlled, you have the option of stepping up, like moving your medications to step 3. If there is improvement within the next 3 months, you can step down, going back to step 2 and further back to step 1. The technique of inhalation is very important in adequately controlling asthma in children. For children 6 years and above who can hold their breath for at least more than 5 seconds or more, the ideal way of inhalation device is to add a spacer. Kindly read on this on the proper technique in children 6 years and above. This is the recommended technique for children less than 6 years old. As you can see, the difference is using a baby inhaler because they cannot hold their breath for more than 10 seconds, so a baby inhaler is recommended. In summary, we have shown the proper way of assessing a patient with asthma based on control. We are guided by the management created by Global Initiative for Asthma, using the different steps and with the proper controllers and relievers. Thank you very much.